Yeah, so over to our host, Temidayo. Can you hear us, please?
I can hear you. Thank you very much. I welcome you all. Good afternoon once again.
Good afternoon.
Can you hear me?
Yes, we can.
Yes, I can hear you loud and clear.
Okay, thank you very much. Today is World Blood Donor Day, and also we would like to celebrate the Sickle Cell Awareness Day, which is June 19. So, in respect of in Nigeria, how voluntary blood donation is going on, we want to know more about it so that maybe we can talk to friends, we can talk to our colleagues about how to go about it. So I would like to ask Dr. Promise that blood donation, what can we say it is? Is it just going anywhere to donate blood? What do we call blood donation? Donating blood.
Okay, that is wonderful. Thank you very much. Admin, can you allow me to share a document?
Okay, yes, you can. Okay, go ahead. You can share your screen now.
Okay, thank you very much. Okay. Can I proceed?
Yes, please.
Yes, of course.
Okay. Basically, when you are talking about blood donation, it only means that ability for an individual to, give out a quantity of blood or a unit of blood, technically, as I may say, in that way, so that patients in the clinic can also survive as far as life is concerned. So basically, that is all about blood donation, okay? And if you could look at the document I am sharing, I think I'm having some technical challenges.
Okay.
All right. Thank you very much.
Dr. Promise, can you hear us? Dr. Promise, can you hear us?
Hello?
Yeah.
Can I hear you, sir?
Oh, okay, but my screen is blank, so that is why I can't
Okay.
really know what is going on. Yes. Oh.
Okay, so
Okay, can you continue? You continue. Maybe
yes, please.
the next speaker whilst I resolve my issues here. Okay.
Okay, yes.
Okay.
Moderator.
All right. Sister Buki, Mrs. Bukola Bolaiwa, can you hear us?
Yes, I can.
Okay. I would like to add, in respect to blood transfusion, the blood donation in sickle cell patients. So what are the mortality rates in Nigeria in respect to blood transfusion?
I don't understand the question. You mean like how many people?
Mortality rate of sickle cell patients in respect to blood transfusion, because some sickle cell patients are unable to get access to blood when they needed it. So can we know the mortality rate or morbidity rate in Nigeria?
I don't think that that data is collected. A lot of times when people die from sickle cell related complications, it's usually you know, like a number of factors, what they call like comorbidities. Oftentimes, it's not just as a result of not getting that transfusion at that particular time. It's usually a combination of factors that triggers it. But in terms of like the number of units of blood generally, because again, like the blood for people living with sickle cell is not, data on blood for people living with sickle cell is not collected on its own. Nigeria is short of about 1,000,000 units a year. That's the data that WHO has kind of put out. And at HIMA, we essentially started trying to help people with sickle cell, but now we really broadened beyond that. So we try to help anybody that needs blood. And so in Nigeria, we're looking to add an additional 1,000,000 units of blood every year. And that's just getting about 1% of Nigerians to register as regular blood donors. That's really the goal at the moment.
Okay, thank you very much. So, according to what you said, the uptake of voluntary blood donation in Nigeria is actually, let's say, is okay as of now. Can we say that is okay as of now?
No, I'm actually saying the opposite, that we need about 1,000,000 more people to donate blood annually. So it's far from okay. We actually need a lot more people to become regular voluntary blood donors. At the moment, the data is showing about 60% of donors in Nigeria are actually paid donors, or what we call replacement donors. So essentially, people go into the hospital and either get some people who they pay to donate money for them, or they get somebody else to come and replace the blood for blood that they buy either from a blood bank or from the hospital, and then they get other people. And sometimes they actually pay people to come and donate blood on their behalf. And those are the kind of situations we're trying to move away from. We're trying to move to a situation where people are voluntarily and regularly going to the blood bank to donate, or donating at blood drives, and the blood banks are constantly stocked. That's where we're trying to get to.
Okay, thank you very much for that. Mr. Rashid, I would like to ask, in talking about blood donation in Nigeria, do we say blood donation is it safe? And how do we go about being that, okay, this blood is safe for us to actually collect or actually give to our patient?
Okay. Blood donation has been since time immemorial, and the techniques for blood donation and blood collection is not something new, and it has been advancing in several folds with different research, and it has been identified. So there are techniques for taking blood and for people to donate blood. So it's practically safe if done in the right place and the right environment. So I mean, every standard health centers know how to get the blood from donors and know who they are supposed to give the blood to, and then whatever complications are supposed to be there. So there are screening mechanism that is being used. So if you are donating a blood, it's not something I should be scared of. So practically, I wanted to answer some questions, but I think I'll just push this part of this question and ask me a fraction of it to Bukola, because I feel it's important if the answer is coming from her. So Bukola, if you can answer this question, you can just like tell us the reasons why sickle cell patients would need this blood, and what are the complications of sickle cell disease?
Can you hear me, please?
Yes, we can hear you, Dr.
Yes, we can hear you.
Oh, okay. But anyway, I can respond, but I'm not seeing anything on my screen. But we can continue. But I can hear whatever is going on.
Okay.
Okay. So can Buki just answer this particular question? So when she finishes part of the purpose of blood for sickle cell disease, then Dr. Promise can come in and talk about every other importance of the blood donation in other aspects of health.
Okay, so the first question is, why do people with sickle cell need blood donations?
Yeah.
Okay, so essentially people with sickle cell, what happens is that your red blood cells are sickled, and that means that they're not able to carry enough oxygen to the various organs and the various parts of the body. And sometimes when people have a sickle cell crisis, your oxygen levels come very low. And what they need to do is, because there isn't enough oxygen in your system, what they're doing is then putting in fresh blood with like new red blood cells into your system. Sometimes they also do what is known as a cell exchange, which is essentially when a patient is transfused with about 6 to 8 pints of blood, and then blood is simultaneously also extracted from that patient. So you're essentially giving the person a whole new set of fresh blood. And essentially what that's going to do is remove the amount of blood that's sickled in the amount of red blood cells that are sickled in your system, and replace fresh red blood cells. And that's going to essentially prevent crisis and prevent some of the complications that come with sickle cell, which includes like organ damage, leg ulcers, and things like that.
Okay.
Thank you very much. To Dr. Promise, can you still hear us?
Yes, I can still hear you.
Dr. Promise. Okay, I would like you to explain more about importance of blood donation generally to everybody in the emergency sector, injury, accident. Just explain to us the importance of blood donation.
All right, thank you very much. Generally in Africa, if we take Africa in general, okay, blood donation, there has been some successes being chalked. However, there are still more, how do you call it, more works to be done. Some of the primary works or some of the primary importance of blood donation is to give life. We say that water is life, blood is water, and therefore blood is life, right? And that is so. According to a research paper, about 20% of blood needed goes to, accident victims, okay? And then blood also helps to cater to prevent maternal mortality and the infant death as well. Now, generally, about 65% of blood being used, okay, goes to 5 years and then downwards. It means that because children are prone to malaria, malnutrition, and other severe complications, and therefore they needed, blood. Or in other jurisdictions, maybe as the other panelists mentioned, that sickle cell people may also, also need blood, and therefore you call something bone marrow transplant, and that is basically plasma. It's kind of some new technology that has come out, although in West Africa, it hasn't been reported that much bone marrow transplant is being done until recently, where in Ghana, around Rich Hospital, where we have some sort of bone marrow transplant going on, only for leukemia-related conditions, but not as, sickle cell. But the sickle cell patients are still using the usual, hydroxyapatite for treatment and other antibiotics and combination therapy. So basically, I would think that, or papers available, evidence-based, those are some of the, the importance of donating blood. Let me quickly mention that in West Africa, only about, if you are looking at systems that's supposed to be put in place, only about 8 African countries are doing well in that regard. But the rest, things are not really going on well. Although, of course, not to regard the fact that some successes have been chalked in other areas, like bulk mobilization of people for, to encourage people to donate blood and what have you.
Okay, thank you very much. For Ms. Buki, I would like you to expatiate more on the importance of blood donation in sickle cell patients.
You are referring to me?
No, Miss Buki.
Okay, sure. So again, part of like I previously explained, is that unlike other patients, so say for example, women that just have a baby or anemic children, they just need 1 or 2 pints, right? With people living with sickle cell, sometimes if you're on a regular exchange transfusion, which a lot of our patients are on, you need about 6 to 8 pints every month, sometimes every other month. And it becomes really difficult when you are, say, you have a red blood group such as AB negative or O negative, or one of those that's not, is a smaller percentage of the population. So unlike other patients that need, 1 or 2 pints, maybe once or twice in their lifetime, people living with sickle cell need transfusions very regularly. And so the challenge is trying to get more people to understand the importance of donating without waiting for someone to be in an emergency. Or the way it currently works at the moment in Nigeria is that, oh, I have a friend, or Rashid will message me and say, oh, my friend is in hospital at this place, please, I need a donor. And then we galvanize donors to go and donate. But really, it shouldn't be the case. It should be the case that anytime a patient is admitted or walks into a hospital, there should be enough blood for that patient. Another reason that people living with sickle cell oftentimes present a more complicated situation is that doctors want fresh blood, right? Blood usually has a lifespan of about 35 days. Now, at each day that the blood leaves the person's body, the number of hemoglobins and so on slowly start to decrease. So if you get fresh blood, and doctors usually like transfusing people living with sickle cell with fresh blood. So that's another situation where we're having to get people to come in through the door. So imagine trying to get 6 or 7 donors for one patient every single month. It presents like quite a difficult challenge for us. So yeah, people with sickle cell need a little bit more in terms of blood donations than other patients may do. Sometimes patients with leukemia as well, because they want to transfuse platelets, also present that kind of challenge.
All right. Thank you for that. Mr. Rashid, I would like you to talk about misconception and myths of blood donation. What do people believe and is not really real in this part of Nigeria?
Yeah, okay. That's a very interesting and important question. So, apart from Nigeria, there have been so many kind of misconception across not just Africa, but the whole world, because it's assumed that um, different reasons, anyways. So for Nigeria, there are some factors that are important to note, for like religious aspects, sociocultural aspects, personal beliefs, um, family spectrum of concerns. Because there are some people that feel like if you are taking another person's blood, there's going to be something is going to happen to them, and this is not true. It's not true. It's not true. There's no scientific um, backing or any evidence to prove that there's something wrong with taking blood from somebody else. Then some people have the religious and challenges where they assume that taking a blood from somebody is is not good, is not right. So, but I can't specifically say the exact reasons why they do that, but a lot of people must have heard that. Then also there is, and this actually creates a whole lot of challenges for some people to survive. You know, when, for example, some cases that I've seen, when patients are supposed to be attended to in a clinic or in an hospital, and then I've seen children that needs blood to survive. And then when the parents take these children to the clinic and the hospital, and then they are told that their religion does not allow them to do that, or does not permit them, or that there is something related to maybe the father does not want, if it's the mother that took the child to the hospital, and then you can see that this child is about to die. and then they are denying the child the right to take this. So there's a particular case where we had to like the mother did not give consent, but we had to bring in another kind of consent from the state government, because it was it was a federal teaching hospital. So we had to take the case up to the federal level and the state where the ministry was involved, and then the child was given the blood and the child survived. So no, any idea that people are having in their head is just an assumption or a passed on misconception that if somebody has this thing or you collect blood from this person, you start behaving like them. I mean, you hear very weird kind of misconception. So it's not true. And the other part that people might be concerned about is maybe if the person has some kind of diseases before, and then they are scared that the person might transmit to them. So, and that's why we have the screening. So every blood that is being collected is screened, and the person that are given to also will be screened to check if it is compatible, and then it goes on like that. So there is the misconceptions are just misconceptions, and they are baseless.
There are just a lot of misconceptions and myths about these blood donations. So, Dr. Promise, can you help us? Maybe there are some solutions to these misconceptions. How can we change people's mind about accepting blood? Because really, I've seen a family, the religious part saying their religion is can't take another person's blood, then the child had to die. So really, how can we correct this part of the world, or let's say the world in general? How can we correct these misconceptions and myths about blood donation?
Yes. Yeah, thank you very much. You see, generally the misconception Rashid mentioned, they are out there. Okay, normally about especially in West Africa, people think that they are, how do you call it? Only males should, because of male dominance, only males should have the power to donate blood. And one of the misconception also is that female think that every month share they donate blood in the form of frustration. Okay. Now, quickly giving you a certain statistics in West Africa, only 14 West Africa countries have, countries prepare blood components, and only 11 countries in West Africa prepare red blood cell concentrate, and only 10 countries in West Africa prepare platelet concentrate, and 10 and also 10 also prepare fresh frozen plasma. You understand? So what are some of the ways that some of these misconceptions could be overcome? One, we have to engage in massive education, because that has been proven somewhere here in Ghana, Comfort Noche Hospital, where they've done it like a festival of that sort, where every year they have 4 times of calling the general public to donate blood. Quickly, before I move on, let's look at one category. Let's look at the category of blood donors. We have one, the voluntary non-paid donors. We have 2, the paid donors, and then we have 3, the replacement or family dependent ones. Okay. However, WHO has encouraged that, according to the WHO strategy, they've encouraged that they want to achieve at least 80% of voluntary non-paid donors, because those have been validated and then seen as safe for people to, how do you call it, when people donate through voluntary way, they classify it as safe. The reason being that there are some transfusion transmittable infections, which is classified about over 4 of them classified by WHO, which is HIV, hepatitis B, hepatitis C, and then syphilis. So those are the categories, and those are the infusion transmittable infections. So to cut the long story short, one, education is the key. We must engage in research. We must explore other, how do you call it, blood replacement avenues, like how do you call it? There are other avenues that we can explore, like iron, how do you, intravenous iron infusion and other stuff.
Okay, thank you very much for that. Ms. Bukola, how can we get people to donate blood? You
Thank you.
talked about it. You said?
Yeah. Go ahead.
Okay, you talked about voluntary non-payment blood donation. So how can we get people to voluntarily donate their blood?
Okay, thank you. I mean, that's the question that we grapple with at HIMA every day. But I think there are several things that we can do. First things is that people have to have a trust in the healthcare system. At the moment in Nigeria, I mean, I can only speak for Nigeria, trust in the healthcare system is very low. People don't believe that. A big thing, so I was on the radio yesterday as well, just raising awareness about this, and a few callers, the same thing that they all say is that, why do I donate my blood freely and then the hospital sells my blood, right? Or when it's my turn to get family members' turn to get blood, you're going to charge. In Nigeria, in most states, it's about 15,000 naira for a pint of blood. If you go towards the east, it's going towards 25,000 naira for a pint of blood. If you're unfortunate and you have a negative blood group, you could be paying almost 30,000 naira for 1 pint of blood. And so people keep asking, why am I giving my blood for free? And you guys are selling it. And if there isn't trust in the system, people will just not give blood, even those that are willing to give, because of that fundamental, lack of trust. You'll be very hard to convince them to give. So I think that first thing is the healthcare system needs to build trust. People also need to feel that they are treated professionally, they're treated compassionately. The thing with blood donation is that if you go in and you have a bad experience, you most likely won't come back. You hear a lot of people say, the nurse was rude, or they didn't take time to explain the process to me, or, I felt like I had a bruise, or I left the clinic and I was feeling dizzy. And all this just comes from lack of communication. It's just the fact that the hospitals are not doing, and the healthcare centers are not doing enough to educate people on what the process is going to be like, what are you supposed to expect, how are you going to feel. The idea when people want to donate blood and they're like, oh, I'm scared of needles, and the nurse or the healthcare person is like, oh, be a man or be strong. These things, they dissuade people from coming back. So I think that's the second thing. Then the third thing is really about education. We can't stop talking about it enough. I think that, for example, COVID-19 has been a good example of the importance of public health awareness, and how, and for a brand new disease that no one's ever heard of, suddenly everybody knows all the symptoms to look out for. Suddenly everybody knows the cures, and that's because of consistent public health messaging and, consistent education. So we in the space, we must never get tired of educating people, of telling people that these are what to expect, these are the fears, and these are the misconceptions. So yeah, I think we all have a role to play.
Thank you for that. So, Mr. Rashid,
yeah,
I would like you to explain the clinical complications of blood shortage, like anemia. What are the clinical complications?
okay. I will not stop at just that alone. So I'm going to just say, so hemorrhage is leading cause of maternal death worldwide. So hemorrhage has loss of blood from pregnant women and all of that. So it's the leading cause of maternal death worldwide. So if a pregnant woman dies, there's every possibility that the person died from hemorrhage, right? Then we have, for example, Nigeria. Nigeria is the top leading, one of the first 3 leading countries that has that have road accidents, A and E, that they have road accidents, road traffic accidents. So when you have about 5 million people having road traffic accidents every year, I know when that actually just happens, the first thing you will need, that you most likely would need, is that that person needs to do some blood, and you're going to need blood for that person. And then we do not have, it's not readily available, just like Buki said. So you have to call a family. That's for those, so it depends, it's in two categories. Those that know some people that know the importance of blood donation, or those that are in the circle. Like now, sometimes if Booking needs someone that would donate now, or I have someone that works in that space, person will post on their WhatsApp status or send to me or anybody that they know that they need blood. So now everybody start spreading the message across. Now imagine those that and sometimes if it does not come, if the blood does not come on time, I mean, there will be a lot of challenges. And you know, it's not just any kind of blood. It's not that somebody will just come to them and say, oh, this is the blood, take. They are screening, they need a type, that a type is needed for them to give somebody the blood. So if in that sector, it's still difficult to even access it, where people can still navigate through social media or calls all around the country before we're able to find someone. Now imagine those that are in the semi-urban area, or those that have maybe a lower kind of socioeconomic class that do not even understand how to start even looking for, have no idea of what this is. So and you know the number of people that are having these road traffic accidents are, the highest number is coming from bike. And then I mean, people that ride bike, to an extent, you will know the kind of socioeconomic class that are coming from. So they most likely will not even have an idea of what they should do. And when they get to when they are going to the clinic, then they start looking for money, the same money that are looking for why they are doing their bike business. So which the blood that they need to buy from the blood bank is now even much more expensive. So how do they want to get it? So a lot of people died due to that. And several other reasons. I've seen cases, a lot of cases where accident cases, the ones I've attended to, the ones I've seen, and the ones that have personally came down from the car to just say, people need to take this, we need to take this guy to the hospital. And then somebody will tell me, no, the next place they're taking them to is one Bobby or one traditional this thing to attend to their broken legs. I mean, this person has lost blood, and this person is going to lose blood if they are going to carry out any kind of clinical operation on the person. So the education is not even in grade, and then we lose people to that. We lose people to maternal death. We lose to people to domestic violence because there is shortage of blood. And I mean, you know what the physical violence is in our society of today: stabbing somebody, injuring somebody from fight, and then you see everywhere people are fighting all around. So you know, it's not just anemia alone. It's much more bigger than that. And people need to understand this as an individual and as a community. And that's the purpose of donating blood. So technically, to reduce death and to reduce all sorts of complications, for at least, if not for everything, for at least the sickle cell patients and the unborn children and their parents.
Hmm. All right. Thank you for that, Dr. Promise. Ms. Bolari Wabuki has mentioned the challenges that the blood volunteers do face. Sometimes the healthcare workers, and they ask questions that why will I donate my blood, and then they still study it. So can you help us talk more about the other challenges that blood donors face in the hospitals, in the environment, like in the society? There are some other things that people say, you want to go and donate your blood, you just die. So I think you can help us expatiate more on the challenges blood donors face.
Okay, as she mentioned, okay, the challenges, they are there. Yes, she made mention of the system, and then I think lack of communication. You see, it's very, public health is very essential in every aspect. As far as public health is concerned, there is a need for people, especially nurses or healthcare professionals, to be taught communication skills, and then maybe, if possible, customer service skills. Because if I go to the hospital, although other groups do not care, all what they care about is how do you call their survival. I quite remember I was at Rich Hospital, and then some two young guys came in. We want to donate blood, and then for them to give for the nurses to give us money. That was what they said. Although they didn't mean it bad, but as how the nurses spoke to the people, even if it is paid, I will not, because you need the blood, I will not even come back again. You understand? The people end up pleading. I understand their perspective because they are also hungry. They needed something to go and what? To go and eat, but they know that they realize that they had an asset, which is their blood, and they can donate it for, how do you call it, for some cities. Then the next was like, okay, for that we don't do that here, but if you can donate for free, that is it. And they asked them, so what are we going to get? Then they said, you are not going to get anything, it's only 1 month, that is it. You know, these are the people who don't have anything to eat, or probably might have not eaten before coming to the hospital. And look at the response. I would think that we will have to take a more pragmatic approach to all this stuff. As far as the education is concerned, it's not only the education, but the education needs to be effective in reaching out the people, the community members. Because even when your relative is sick in the clinic, sometimes although we are much dependent on the extended family system as far as our sub-Saharan Africa or West Africa specifically is concerned, there are people who still feel reluctant to donate blood just because of the misconception. And the misconceptions can be prevented if we, the healthcare professionals, or how do you call it, the authorities, get to communicate this very well in the form of employing customer, how do you call it, relation. When I was taking my, how do you call it, my COVID-19 training by WHO, one thing that was emphasized on as front health liners is that it's not, you are not only looking at the biomedical aspect, you are looking at social science aspect, which means that communication is very key and must be emphasized on. So the whole thing boils down to one, as she mentioned, trust in the health system. Because once you don't communicate to me well, and I have a perception, and perceptions are not always, in actual sense, they are not factual. They are things that at the long run they are not true. However, we hold on to those ideologies because of inability for us to communicate well. Thank you.
All right. Okay, thank you for that. So in 1 minute, Ms. Bukola, I would like you to help us expatiate on how do we increase the accessibility of this blood for sickle cell patients, the donated blood. How do we increase the accessibility of it for the sickle cell patients?
With blood, there isn't anything like this blood is for a sickle cell patient and this blood is for, this patient. The truth
Exactly.
is more people to just donate blood. That's just it. If the more people donate blood, the more blood available in the blood bank, the better it is for people living with sickle cell. The more we're able to galvanize donors, voluntary donors, to be able to give regularly, not to have to be coerced or, forced or paid to give. That's how it's going to benefit, people with living with sickle cell, but as well as anybody that has a blood condition or any condition actually that needs blood.
Okay, thank you for that. Do you have anywhere people can donate blood in Nigeria where they can go to?
Yeah, so it depends on where you are in terms of states. So if you are in, for example, Lagos or Abuja, you can donate at any of the Lagos states. In Lagos, you can donate at the state blood transfusion services. You can also donate at Luth. You can donate in Lagos Island, in Unicom. And then we usually organize blood drives as well. If you register on our platform, Haima Health, we'll send you messages on when we're having blood drives as well, so you can come out and donate at any point where we're having a blood drive. If you're in Abuja or in any of the other states, you can either donate at the National Blood Transfusion Service Centers, or you can donate at the national hospitals within the states. In Ilorin, you can donate at University of Ilorin Teaching Hospital. So most of the federal hospitals and teaching hospitals, you can actually go and donate. But I must say that, part of the challenges again is that the experience is not very positive for people that just walk into a hospital to go and donate. We've had situations, even for when patients need blood, and we say, okay, go to this hospital in Gariki, for example, and they'll tell them, oh, okay, we'll do a test for you. And the donor will be there waiting for 2 hours. So why should I have to wait 2 hours to give my own blood? I mean, because the whole experience from beginning to end is not a positive one, until we make it a smooth and easy process for people, I think we'll always continue to struggle with getting and increasing our blood donors.
Thank you for that. We really appreciate you. To our audience and participants, do we have questions for our facilitators?
Okay, so,
Anybody with questions?
so before that, I wanted to add something to what Buki said. So we know there is this challenge, but the purpose of today is to enlighten people to know that regardless of all the challenges, we can still do something. So at least I can be certain of the state's blood transfusion service, and maybe at the federal level. But for some smaller clinics and hospitals, I think that's where the challenges lie. Because I'm sure when you get to Lagos State Blood Transfusion Service, you are highly welcome. I've worked with them for how many years now? Maybe 10 or 12 years. And the federal level too, I've worked with them. In fact, I've organized a program in Ilorin, and then they came all the way from Abuja to Ilorin. I mean, so they came to supervise, participate, and all of that. So, but the thing that we want to actually enlighten people, which is people like you and I, is that we should try as much as possible to, like, I mean, it's just like once or twice in a year that you can just go and donate blood. And I think we can look for another system of blood donation. So like the Bookies initiative, Emma initiative, I think we can just communicate with them. So I think Emma initiative needs to do something more, like not just limit it to the state, and then have partnership with several hospitals or clinics, or have like different branches where people can come to, like they know that in this state there are 5 centers, maybe based on each of the local governments, and then in that way they can create a system where you know the number of people that are coming to donate blood, and you know the number of people that are taking blood, and then there will be a system that will cover that. But I think people have some questions, so I think we can just take.
Yes, we have one question from Tola, and I would like Dr. Promise to answer that. What do you have to say about people who donate blood as a business?
Okay. For people who donate blood as a business, okay, my perspective, you can't also blame them because of the system. In actual sense, WHO haven't or do not or hasn't yet abolished that system totally, because they still recognize it. Because as I mentioned, there are 3 types or three categories of blood donors. People would like to pay, people would like to sell their blood in a form of getting something. All boils down to the economic perspective. And these do not happen in the advanced world. You understand? And it's only in our part of the world that paid much of the paid blood donors exist. I'm not saying that it doesn't exist totally in the advanced world, but comparing it to that of West Africa, it's quite high. Okay, and therefore WHO does not discourage that because it's going to save lives. And as a matter of fact, let me emphasize that no one can really sell their blood for a certain amount for a certain amount. It can only be a remuneration. That is how they call it. Just a motivation for people, for the person to come back again, blood donors at least.
Okay, thank you. So, Mrs. Bukola, there's a question here for you from Eze Ugone. He said, please, I don't get what you said on how people get leg ulcers or organ damage from blood donation, the effect from the receiving side. I think the person is mixing things up, but please, can you expatiate for him?
Yeah, so what I was explaining was that part of the reasons that people living with sickle cell need blood donations is because a complication of sickle cell is leg ulcers and organ damage, and blood transfusions are used as a treatment for that. So it's for people that have leg ulcers or organ damage. One of the treatment protocols is to have a blood transfusions. I didn't say that a blood transfusion can cause a leg ulcer. No.
All right. Thank you very much, everyone. For Mr. Rashid, can you give us the final encouragement, word of advice for voluntary blood donors?
Okay. I think what I would just like to say to end all of this is, we should see it as not something that, okay, yeah, I'm just doing a humanitarian service, but something that, because it's actually life-saving. What you're doing is just saving a life. So I think we should start seeing it that way. And when we start seeing it that way, we'll be able to like fine-tune our thoughts into the purpose of donating the blood. So when we see that, when we know that, I mean, for those of us that know the importance of all this, so I think it's important for us to do this, to take, even if it's just once in a year. I mean, it's just once in a year, and the whole process is not up to 30 minutes. So while we encourage the health centers and the facilities that do these things to attend to people, let's be patient when we go to these places. To be frank, the reason why some of this happen to them is because they don't have a system in place. Like they're not very expectant of people to come to just say, okay, we want to donate blood. So they don't have a system where they say, okay, oh, yeah, this is the person coming, and then we need to attend to this person, and then we'll go on like that. So on the other hand, another initiative will be conducting in partnership with so many other organizations in Nigeria. They will be carrying out quarterly activities of all of this. So we use our resources in different places, in communities, several communities, housing communities, school communities, workers communities. So in all these places, and then we try as much as possible to just give an incentive to encourage people, because whenever we want to do things, or when people do such things like this, it's not something that we have to just look at as if it's just a mere thing. It's something that is so important. And then we had about 20 participants that I saw earlier on this group. So the registration for this particular event online, we asked a question there that, would you like to participate in blood donation? So if you are willing to participate, you can log in on the form, or you can request for the form, we'll send it to you. And then secondly, you can also go to IMA initiative, you see it there. Another option is to go online, just Google blood donation centers in your state, or go to the National Blood Transfusion Service. The National Blood Transfusion Service they have their listing in all the old states in Nigeria, and I think it's the same thing with Ghana. So I think Ghana's system is actually much more planned in a way, and then all thanks to the population, not so much. So I think that's what we just need to do. So we should just try as much as possible. It won't take anything from us. I mean, we always pump blood. There's always blood. Some of us even have in in essence that we can actually just help. Yeah. Oh, somebody said IMA Health gives souvenirs. I think this person has been
delay in the donate part,
yeah,
and others.
Okay, so thank you. That's my suggestion.
Thank you very much to our speakers. Dr. Promise, thank you. Next time we call you, please answer us. And Ms. Bukola Bolariwa, we are very grateful. And to all our participants, thank you very much for joining us on this wonderful discussion.
So I want to collect share too. Somebody is notifying us that I give you share. Okay, please, location.
Enough shirts for everybody.
Okay. All right. So what's today's date? So I'm going today. Let me go and donate my own blood. So if you are in Lagos or Abuja or Ibadan or Ogun State or Ilorin or Ghana or Accra, Tema,
Anywhere.
anywhere, just I think IMA initiative, you are in Ghana, right?
What?
IMA initiative.
No,
Oh, I thought you were in
we
Ghana.
worked with someone who organized the blood drive in Ghana, but it's not like a permanent thing.
Okay, I think
Um,
Okay, you just have to
Dr.
brief
Promise
me
can
on this.
join
Let me
you
know more.
in doing something like
yes,
that.
Dr. Promise, maybe you'll be the one helping us
Yeah,
galvanize
so you
Ghana.
have to just brief me and then I'll know what to do.
Yes, sure, sounds good. We are ready to go international.
Great, that's
So
fine.
anybody that donates blood today, I have a gift for them. When you collect your shirt from IMA, I also have a gift for you. So let's go and do
Correct.
that.
All right.
Thank you,
Thank
everyone.
you, everyone. See you
Okay,
next.
Bye.
thank you very much.
Bye.
Bye.
Bye.